Welcome to the Chat with Chou podcast, hosted by Chou well-being and belonging consultant, best-selling author, and sought-after speaker. Join Chou as she connects with both new and familiar faces, showcasing their inspiring work and businesses. Together, we will explore insightful conversations, practical tips, and valuable resources aimed at fostering individual and collective growth both personally and professionally. Let's embark on this journey towards greater well-being and belonging together. Hello, everyone. Welcome to another episode of the Chat with Chou podcast. And today I have Dr. Clarke with us, and it's such a pleasure to have him here with us. Clarke is the president of the Association of the Treatment of Neuroplastic Symptoms, which is a 501c3 nonprofit dedicated to ending the chronic pain epidemic. Dr. Clarke holds a medical degree from the University of Connecticut School of Medicine and is a board certified in internal medicine and gastroenterology. He's the host of the podcast, The Story Behind the Symptoms, and his organization's mission is to advance the awareness, diagnosis, and treatment of stress-related, brain-generated medical conditions. Thank you, Dr. Clarke, for being here.
Great to be with you. I'm looking forward to our conversation.
Beautiful. So without further ado, if you don't mind just sharing a little bit about more, I guess, about your work and what does the association do? And many of us probably never heard the term neuroplastic symptoms. So what are they? So we're all ears here and willing to learn from you.
Yeah, you bet. Well, most people assume that if you've got pain or illness, it must be coming from organ disease or structural damage. But it turns out there's this whole other enormous category of people who have pain or illness caused by symptoms from the brain, from brain-generated nerve impulses, changes in nerve pathways in the brain that can produce real pain or illness in the body. And we call these neuroplastic because the neuro implies the brain and nervous system are involved. But the plastic is actually quite hopeful because it's a jargon term that means a capacity for change. And that means that these symptoms can be successfully diagnosed and treated. And I've been doing this since the 1980s with people, over 7,000 who had symptoms that were not explained by diagnostic tests, but were every bit as real as those caused by other forms of illness.
Definitely, definitely. And as you're sharing that, I was just thinking about, family members, myself, who've been through a long, history of medical condition that could not be explained. And then you have all the symptoms. They can't find anything on these scans to explain the symptoms. And then, often people get diagnosis like FND, right? Functional neurological disorder. And you're like, what in the world is this? And some doctors, not just doctors per se in the medical field, but many people who are not always aware of it and then, can attribute that just being in your head, which with some of the work that you do, there's part of it that could be true, but not from the sense that people are looking at it, right? So, so
Not in your head, in your brain.
there you go. Yeah, big difference. Exactly. Exactly. So I'm just so thrilled that we get to have this conversation because I know that, personally, I need this and professionally, I know so many people who I support, who follow me, who definitely can benefit from this. And so my next question here, kind of like a lot of the work that we do here with Crystal Consulting focuses on helping individuals and organizations address chronic stress and its impact in well-being. And so I'm interested in learning more from your work with neuroplastic symptoms. How does unresolved stress manifest physically? And why do so many people miss that mind and body connection?
Oh, those are a lot of great questions. It turns out that the stress can physically change the nerve pathways in the
Mm,
brain. And it can be stress in your life at the moment. It can be stress from the past. A lot of my patients, even a majority, went through adversity as children that is still affecting them today.
yeah.
And it can be very obvious adversity, child abuse and so forth, but it can also be much more subtle, where people were perform at a high level and they never could seem to achieve that
Mm,
to the satisfaction of their parents, for example. All kinds of more less obvious conditions in people's families that can make them feel like they're just not measuring up.
yeah.
It can be trauma that people have been through. It can be unrecognized emotions. It can be triggers that are going on in their life. It can be unrecognized depression or anxiety. If people are curious about this and they have symptoms of their own, there's a 12-question self-assessment quiz on the
Nice.
website of the nonprofit symptomatic.me, and it can find out a lot of information about a person in less than 3 minutes. So I
Wow.
encourage people to go there.
Yeah, I'll definitely be going there myself because it's so what I've noticed, in my life and many others is that often, you'll find medical professional in kind of the psychology, psychiatry lane, and we'll look at the depression, the anxiety, and all those, mental health conditions per se. And sometimes then we don't always find medical doctors who are focusing, like when you go for the physical symptoms, can actually even make the connection between the two. So often people feel misunderstood, and I know, that happens a lot of caregivers and people with chronic stress, chronic illnesses and even leaders, because like you said, we have that many of us might be carrying a lot of stress and a lot of trauma that starts impacting our health. And then when we seek help, we might not always be not feel empowered by the people that we are seeking help from. So, and I know even just a little bit that I've learned so far that your approach, helps people not to feel broken, and that may be putting in the simplest term, but that's kind of what, just reading your work, and I'm like, yeah, this is it's so needed. And so if you don't mind sharing a little bit about that, like how does your approach kind of help people make those connections and then feel more empowered and understood in their care?
Yeah, my patients are actually the opposite of broken. They're actually, for the most part, stronger than
Mhm,
average.
mhm,
They're simply carrying larger realize. I
mhm,
think of them in many ways like Olympic weightlifters who, unbeknownst to themselves, they've been asked to carry 50 pounds more than the
mhm.
world record for their weight class on their shoulders.
Yeah,
And, anybody's body is going to break down under that kind of a strain. And it
yeah.
doesn't mean people are weak or that they can't handle their lives or their stress. It just means that there's a whole lot more on their shoulders, than they're appreciating. And I should point out the result of this is the symptoms that can be almost anywhere in the body. It can be
Mhm,
migraines, back pain, fibromyalgia, irritable bowel syndrome, chronic fatigue in many cases, long
mhm,
COVID in many cases, certain kinds of rashes, pelvic pain, joint
mhm.
problems, functional neurologic disorders you mentioned. The list goes on and on. The only common denominator is that people tend to have more than one symptom at a time. Not
Yeah.
always, but very commonly. So what I do when I have a patient like this whose diagnostic tests are not showing the explanation,
Mhm,
is I'm looking for, what are the stresses that are going on in somebody's life? Have they had a stress that kind of goes up and down in their life, and their symptoms go up and down with it? That's very common. Or
mhm,
are the symptoms more frequent or more severe when they're away from a safe environment?
mhm,
That happens to a lot of people with unrecognized anxiety disorders. What did they go through as kids? I'll ask most of my patients, did you have any experience that would make you sad or angry if it happened to a child you care about?
mhm,
If you had to watch a child of your own or another child that you care about grow up exactly as you did for even a week or 10 days, would that make you feel sad or angry? And if it would, we need to talk about that. We need to find out what kinds of impacts that might have had on you as an adult today.
mhm.
So when people see these connections, they've finally got an answer to why their body is trying to communicate with them in
Yeah.
the only way it knows how. It's trying to say, we've got some distress up here, and we want it to be addressed, but we can't make you consciously aware of it. So we're just going to yell and scream here in the body for a while until you pay
Mhm.
attention.
Yeah, yeah. And I think that that's such a great way to put it. Our body is doing what it needs to do, our brain is doing what it needs to do to bring it to our attention. And sometimes I find, many of us who are, high achieving people wanting to do so much for others and for the world that we go, go, go and don't listen to what, no, but the message the body is sending to us. Do you find that even kind of I would say the flip side of it, but that even being quote unquote a perfectionist, while having that internal pressure to always do well, to always do better, do more, can contribute to some of those brain generated symptoms as well.
Yeah, absolutely. I mean, if you are somebody who is driven to help others, oftentimes the flip side of that is you're not putting yourself on the list of people you take care of.
Right.
And so you're going and you're going, you're living like you're on a treadmill that you never step off.
Mm,
And sooner or later, your body is going to force you to step off. It's going to make you hurt. It's going to give you some other symptom. It's going to perhaps give you profound fatigue. In my own podcast called The Story Behind the Symptoms that you mentioned, I interviewed somebody just recently who was a Royal Marine in England. Somebody who's an expert on handling stress and fear and who's got tremendous physical and mental capabilities.
mhm.
He got chronic fatigue too. For 5 years, he could barely function. So even somebody as mentally and physically strong as that can be brought down by these brain to body conditions. Once he found what was going on and once he learned that there were some serious stresses behind it,
Mhm.
uh, within 3 weeks, he was vastly improved.
Wow, wow. And that story is so powerful to think, just as I'm hearing this, someone who struggled for 5 years with chronic fatigue and then be able to reverse that in 3 weeks. That that
Yeah, it
that
was
is
really striking. Not everybody can do it so quickly, of course, but he was successful in doing that because he realized that he had been, pushing himself nonstop, and he needed to
Mhm.
take a little more time for his own joy.
Yeah.
Many of my patients who have these characteristics, they acquired them when they were kids. They were in an environment
Mhm.
that
Mhm.
was difficult for some reason, any of a variety of reasons, some of them obvious, some of them not so obvious, where, when you're a kid in a difficult environment, you don't have that many things you can do to try to fix things.
Right, right.
So people learn at these early ages, I'm going to try to solve these problems in my family. I'm going to try to be the best little kid I can be. I'm going to try to be perfect. I'm going to try to fix everything. And they learn this as kids as their strategy for coping. And when you learn it at such a young age, it tends to become part of who you are,
Yeah.
becomes a basic assumption, and it's who you are as an adult too, until you finally can listen to your mind and say, look, we need to do things differently.
Yeah, yeah. And I think there's, so much of kind of that survival mode that, trauma kind of pushes us into, right? And we don't even realize, especially as kids, people don't realize, children, that is trauma, that, your brain is trying to help you survive, but we then grow up, become adults, always on, in survival mode without even realizing it. And then,
Yes.
yeah, it's sad. Then the body just functions at that level until it can no longer do that. So going back to kind of listening to our bodies, like if someone is listening to this, to you and I speak here, and then they're like, oh, I have some of those things that Dr. Clarke is mentioning. What are some of the first maybe ways that they can start listening to the body? Like, what does that actually look like, in practical ways?
Yeah, the first step is clearly to shift your attention, if you possibly can, from the part of your body that has a symptom
Okay.
and just decide, okay, I've got this symptom. It's not dangerous. It doesn't mean I'm going to be lifelong disabled. It's not meaning that my body is breaking down. The doctors have
Mhm.
checked me out. I don't have an organ disease. I don't have a structural damage. The body is okay. It's just my mind trying to communicate to me that it is in a state of distress. So we need to shift attention from the body to the mind and try to think about, okay, what is the distress? We're not going to be afraid of what's happening in the body anymore because it's just a form of communication.
Mhm.
It's trying to help us. It's on our side. And if we can use that as a message to pay attention, okay, what's the stress in my life right now? Do I have a trigger going on?
Mhm.
One of my patients had been hospitalized at a prestigious university 60 times in 15 years for
Mhm.
attacks of severe dizziness and vomiting. And they couldn't figure out what was wrong. In fact, my first book is called They Can't Find Anything Wrong. And that was the
Mhm.
situation with her. She
I
saw
definitely
a
have to look
dozen.
for that book. I want to read it.
a dozen specialists she saw. And
Wow.
the specialists got so frustrated that they had a psychiatrist come and see her.
Mm,
And, as is the case with most of my patients, the psychiatrist said, nope, she's mentally healthy. No problems here.
wow.
But in truth, her condition was triggered by her abusive mother. Her mother had been abusing her since verbally and emotionally, not physically or in any other way. But for 47 years, since she was 3 on up until age 50, she was still
Wow.
mistreating her. And I was able to show this patient that her attacks of illness were all connected to
Mm,
direct or indirect connections, interactions, contact with her mother. And
yeah.
as soon as she saw that, I can still remember her looking up at the ceiling and going, "Oh my God, I can't believe this."
Yeah.
And in her case, just bringing that into conscious awareness was enough to alleviate her condition. She called me a year later and said she had gone through the entire year without an attack.
Wow. Wow. That's amazing. Knowledge is power, right? Knowledge is power. Yeah.
Absolutely.
And it's so, and it's, it's scary when you have, when for anybody been through it, have a lot of, medical symptoms, going on in your body and nobody can, doctors, medical field cannot figure out what it is, right? So you might be like, well, am I the only one with this, some rare disease, right? And so it's not physically you're dealing with the impact of the symptoms, and then emotionally there's that fear, the anxiety that's still coming in, kind of eating at you on top of everything else. And so, as I was just sharing, like just even bringing that awareness, to people's consciousness, right? It's like this is where it's coming from. This is, how it's connected. That alone, I can imagine, like you share in in this lady story, it automatically start reducing some of the anxiety. And then I
Yeah,
love the approach you shared earlier about kind of reminding yourself that our brain is just trying to, send us a message, and that we're okay. And that even that too, continues to reduce some of that and the anxiety and the stress then. And yeah, it's powerful.
definitely. Well, and a next step is, especially for people who are caring for everybody else in their world and
Mhm.
they struggle to put themselves on the list of people they take care of, I want them to learn self-care skills. Many cases as kids, there was so much going on in their household that they didn't get sufficient opportunities to play. And
Mm,
when we play as children, we are learning what I call self-care skills. And if
yes.
you don't learn that, you're going to live as an adult thinking that it's your job to take
To take
care of everybody
everybody
else.
else. Yeah.
And so what I want people to learn is to how to take care of themselves, how to do for themselves what they are already doing for everybody else. And
Mhm.
that means taking, if they possibly can, not everybody can do this, but take a few hours a week, 3 or 4 hours a week, if you can manage it on a regular basis, to get out of the house and just experiment, do trial and error,
Mhm.
find activities that have no purpose but your own joy,
Yeah.
because
Yeah.
everybody needs that. It's an essential human skill to be able
Yes.
to have something in your life that just gives you pure joy. And it can take, my patients months of trying this and trying that to
Yeah.
find out what that is for them.
Mhm.
One of my patients was a champion athlete as a girl.
Mhm.
But she did her sport before school, after school, on weekends. She never really got to be a kid. And this
Good.
was from
Yeah.
age 4 to age 18, she was
Wow.
doing this. When I met her, she'd been in the emergency room all night long. She was in her 30s
Mm.
for acute abdominal pain. And, all the diagnostic tests were normal. And I was talking to her about her early life, where, again, it was kind of like she had a job starting at age 4.
Or yeah.
Now she's in her 30s. She's got a full-time job. Her husband's got a full-time job. She's got 2 kids. She's
Mm.
coaching her kids in her sport. She's coaching other people's kids in the sport. She's on the athletic club board of directors. She
Mm.
drives kids to out-of-state competitions. There's no space anywhere
To breathe.
just
Yeah.
for her.
Mm.
And she just finally hit the wall, and her body just goes, gave her a horrible abdominal pain one night.
Yeah.
So her solution was to, and her husband fortunately was 100% behind this,
Beautiful.
to go out and start thinking about what would be fun for her.
Yeah.
And at first, all she could think of to do was go for walks in a park.
Mm.
And that helped. I mean, she
Yeah.
was better, but the pain continued
Yeah.
at a lesser level. But while she was walking, she was thinking. And eventually she hit on the idea of taking piano lessons.
Mm.
And she'd never done anything musical before, but she absolutely loved it.
Yeah.
And that was when her pain finally went away.
Beautiful. And no, stories after stories, what I keep hearing, it's the opposite of what though most of us know about the medical field. Where often when people hear I'm going to see a doctor, they're like, oh, how many pills are going to prescribe, right? How many times I have to go back and see them? And your approach is so, holistic and very trauma informed, which I love because I do a lot of work around trauma. It's set up, finding that connection between what happened to us and what's happening to us now. And then reminding people to just be human again. I often I ask, adults, many of the adults that I work with, when they're stressed, like, when's the last time you played? Because, like you said, many of us might have not had the chance to play when we were younger because of all the demands put on us, and we thought we had to take care of everybody else, and that continues. And when we get older, it's like I'm too old to play, and now realizing finding those things that brings you joy or is healing in itself. You know.
Yeah, and people, I have to warn my patients, they're going to feel guilty when they do this. It's going to feel
Yes.
like, this is selfish. I can't spend time on myself. I mean, that's just being too self-centered about this. But it turns out that it is an essential thing that
Mhm.
everybody needs to have. Myself, I used to play soccer on up to 3 teams at a time. That
Wow.
was my personal joy. After being kind and compassionate with my patients all thing.
Mhm.
And and we'd go out for a beer afterwards, the team, and that was my personal stress reduction. I'd be ready for the week after that.
Yeah, yeah, wow. Thank you so much. I'm just grateful that we were able to have this conversation. And I'm thinking about, I'm gonna go on the website and we'll share the link there, to take that self-assessment, and with symptoms and you said it was 3 minutes, right? You can kind of have a better picture of what's going on with you. But are there other ways that we can connect with you that people can who might be listening, like, yeah, I think I need Dr. Clarke, right? How do we connect with you and what does the process look like to receive care from you?
Yeah, I'm just a teaching doctor these days,
Okay.
and I'm not seeing patients because I run the nonprofit, and that takes up a lot of my time. Plus, I give speeches and do podcasts and edit books and all those things to try to reach as many people as I can. And so I don't have the resources in time for one-to-one care. But the resources on the website, I've
Okay.
got, videos and courses, and we have recommended books by myself and others. So there are a lot of resources there that people can use to help themselves, plus a whole directory of clinicians like myself who've taken extra training to learn how to do this. And there's several hundred of them around the world that are doing this work. So lots of good resources there. And I should add that in addition to the stories that I love to tell, we now have very solid research on this from leading centers across North America, published in very rigorous journals that have shown that this is highly effective as an approach to chronic pain and illness.
Yeah. Well, thank you. And I was going to ask about that directory. So I'm glad, you mentioned that. So yeah, for everyone listening, if you need this, definitely the website has a lot of resources to start that healing process, that recovery process for our brains and our bodies. And then definitely connecting to one of the trained professional who are already connected with you and kind of continue this work. But thank you. I mean, what beautiful just the body of work that you created here and for now and the future. This is it's amazing. And so thank you. Thank you again for being here and thank you for all that you do.
Thank you very much. I appreciate your sharing this with your audience.
Thank you. Anytime for anyone watching, listening, please, like we often say, sharing is caring. All of us can probably relate to the things we talked about here, and all of us probably know at least one person who can benefit from this. So please share it out. We'll share the website as well, which we'll put in the show notes. And until next time, be well, do well, work well, and lead well.
Thank you for tuning in to the Chat with Chou podcast. We hope today's episode inspired and informed you on your journey towards growth. Be sure to subscribe, rate, and leave a review. Follow Chou Allegra on social media to stay updated on upcoming episodes and more resources. Until next time, take care and keep striving for well-being and belonging in all areas of your life.